UCSF Sports Medicine Podcast, 6 to 8 weeks, Perspectives in Medicine. During our program, we continue to cover a variety of hot topics in the sports medicine world and more.
Welcome, everyone, to our UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Nirav Pandya, Dr. Brian Feeley, and Dr. Drew Lansdown. Even though the Golden State Warriors are not in the finals, we do have an exciting NBA Finals coming up between the Dallas Mavericks and the Boston Celtics. Obviously, with any NBA Finals at this point in the season, there's a lot of wear and tear on athletes and injuries that'll play a key role in determining the outcome of the series. We also, as Warriors fans, see the return of Kyrie Irving to the NBA Finals after his stint against us in 2017 with the Cleveland Cavaliers. So maybe the first question, I think the biggest injury that everyone is concerned about, and an injury we've seen a lot in the NBA playoffs, is the calf strain of Kristaps Porzingas. So, it's been a couple of weeks since he's played. Obviously, big, tall guy. So, kind of, Brian, what are your initial kind of thoughts when someone does come in with a calf strain? Maybe we'll start with that globally. What are some of the things you worry about, and what's kind of some of the return to play criteria?
I think for anybody that's had a calf strain, the question is can he jump? And I think for Kristaps, playing a center position against quick players and people that penetrate a lot. So you think about playing Dallas specifically, you have people that are going to be driving against him. Is he going to be able to backpedal quickly and jump and defend in the paint? He's had plenty of time off. If he feels 100%, he's going to have till Thursday. So at that point, it's going to be 3.5, 4 weeks off. The problem is unlike many centers where they can play more flat-footed. So if you think about Rudy Gobert, he plays a very different game than Porzingis. Porzingis plays a more vertical game. So Porzingis has to be able to essentially be more playing anterior to posterior, more vertical up and down, and then come back and forth to cover everybody against the Mavericks. So I think he really has to play 100%. But if he has any pain when he plays, the risk is that as soon as he plays, he's going to re-injure himself. And I think the other issue is playing behind him now has essentially may have overextended himself. And this has been brought up by some media people as well, is that Horford, when he's been played 20 minutes on average during the regular season, and now he's been playing 30 minutes in the playoffs, and he's 38 years old, and he's looked 38 years old for the last decade. So at some point he may get tired. Right now, hopefully this extra rest for Horford makes him feel pretty good, but I think they're going to have to balance how much he plays, especially if Porzingis comes back on a minutes rotation.
One question for you, Drew, I'll take issue with Brian said Gobert playing defense. Gobert doesn't actually play defense, as Luka will tell you. One of the things is that the Celtics have been doing really well without Porzingis. They're 9-1 since the time he's gone off. When you were kind of covering teams, when you're in fellowship, is that a consideration? Do sometimes the return to play, kind of with medical staff say, hey, we can give him a little bit extra rest because we're playing well? Or does sometimes that play into consideration in terms of the urgency of clearing a player to return to play?
Yeah, I think it wouldn't come in too much on the medical side. Because I think, on the medical side, it's really our better role is to say hey, he's ready, or, sure, he could go, but he's going to probably be limited, or, this is going to make it worse if he tries to push through this. And then on the coaching side, I think it could be if it's hey, he can give you 80%, then it's well, actually, we're fine without that. We're moving along pretty well, and that's not going to be worth adding to the lineup. And I mean, I would think, even him coming back, they've been playing great without him, but just that added depth should, just extend their lineup even more. And, like Brian was saying, relieve Horford from some of those minutes. And somehow he is totally ageless, it seems. But I would imagine, dropping him down a little bit would, make him play even better through this last stretch.
Yeah, I think that Horford,
I just want to...
over to Horford. Oh, fine.
Yeah. I just want to point out that a couple of weeks ago when we did the last injury update, I picked the Knicks to win. I want to point out that I forgot the Celtics were in the playoffs at that point, so I'm still picking the Knicks to win.
Good pick, yeah.
Yeah.
Thibodeau is probably going to come and overwork you, and you'll have to take a couple weeks off anyway. So.
Yeah. I'm fine with that.
it's kind of shifting back over to the Al Horford stuff. If you look at the statistics, he averaged about 21, somewhere between 21 and 28 minutes, kind of in April and March. And then he's been averaging about 30 minutes per game in the playoffs, 35 versus the Pacers, 31 versus the Cavs, and 25 versus Miami. And his playoffs in the last season was 30, it's a pretty remarkable for two reasons. One is you usually can see older players bump up their minutes, like that in the playoffs, just given how much wear and tear. And at 38, playing 20 to 25 minutes per game in the regular season is pretty impressive. What do you think about this the concept of load management with these older players? I mean, obviously with the younger players, it's a different story, but, is there any kind of data behind it? Do you feel like this is something that's actually shown to make a difference? I mean, everyone's always bringing up so many soft tissue injuries in the playoffs. You had Jamal Murray, you had all these calf strains, you had, everyone on the Knicks, getting these issues. Does that actually mean that load management actually does work or doesn't work? Like, what are your thoughts on that, Brian?
I think it's a little bit early to say. I think when you look at this season in particular, too, this is the first time we've had the in-season tournament. So the schedule is a little bit different. So you had more days off in the first half of the season, fewer days off, more back-to-backs in the second half of the season. So I think it's not unsurprising that you're going to have a few more strains in the second half of the season just because there's more wear and tear. And the fact that you have what seems like a few extra in the playoffs this year, that can just be a statistical anomaly, but it can also be because we did have more back-to-backs and we did have a few more we had a more compressed season because of the play-in game, or not the play-in games, the in-season tournament during this season. So I think over a couple seasons, we'll figure out, do we need to revamp the schedule a little bit? Because I think overall, the in-season tournament is, by and large, net positive. I think it brought more excitement. It brought more competition. I think all that is overall positive. The downside is, though, you're playing more competitive basketball for a more extended period of time. That may be a little bit more challenging on the players and the athletes' bodies for a longer period of time. That may increase that risk of soft tissue injury throughout the year.
One of the things that I think we don't talk enough about with this is like how, what's the load of these players coming into the league? Like we're basically concentrating on these older players and they can take time off. But the NBA doesn't seem to necessarily look at, what are these players doing in high school? What have they done in junior high? What are they doing in college? By the time they come in, they already have so much wear and tear. What do you think about potentially the concept of the NBA kind advocating for more rest so these players aren't coming in so burnt out or so with so much mileage on their bodies by the time they're 20, 21, 22? Drew, what do you think about that concept?
Yeah, I think it's a great idea and concept. I think it'd be really hard for them to implement and to have, any of these other leagues listen to that, like, hey, don't wear our future players out and don't worry about your product. Just wait until they're with us. And I think a lot of it's probably on the players, and that gets hard too, because, if you say, well, I want to show that I'm, at that level, but I'm going to just play less than the other guy, that availability really hurts you. So it's a tough problem because like it's totally in their interest to, limit these overuse injuries that can develop, but they don't quite have the control in those other leagues to put something in place.
Well, I mean, Nirav, you're the one that's done not most of the research, but at least a lot of the research on it. How would you set this up? You've been made youth sports czar 2025 to 2028. How would you set that up?
Yeah, I think the hard thing, just like with, baseball and softball, it's hard to kind of individualize like games and kind of how much people are playing. But I think if with AAU, where a lot of these kids play, if they came together as an organization and limited the number of tournaments per weekend or how many games you could play during the course of a weekend, if there are limits on that. Because I think, just like with baseball, where showcases are associated with increased injury risk, I think these huge tournaments where kids are flying across the country playing a lot would be key. And I think sometimes it's just education. I think soccer is starting to get better with, say something like ACL, and people are understanding why you have to do ACL prevention programs, but it's been taking, 10 to 15 years. I think if that message gets across, I think it's important, but sometimes you just have to just limit how much these kids are playing, particularly at the elite level. You can't do it for every single AAU tournament, but if you take some of the top tournaments in the country and say, hey, these are the kids who may be playing in the NBA, let's limit the number of games they're playing for the course of a weekend so they don't get dropped down. Maybe that would be the best way to do it, but it's hard because there's money involved with that.
Right. So then I could have played then. They'd be like, that guy, he could play all weekend.
He's going to be making JV at SI. He's not going to be playing much at all.
I think I do think it's tough though, because those kids also want to play. So you have to actually limit them. But I think it's important to at least give, I think what you said is education is key. Letting, active advertising, which some groups do. They talk about the importance of playing multiple sports. And I think some athletes go out and talk about that. Steph Curry talks about he played multiple sports in high school. Bryce Harper talks about that he played multiple sports, multiple positions, that he started out as a pitcher and then played multiple sports. I think that education that says it's okay to go play the sports that you love now when you're in middle school and high school, and let young athletes know that they can have their other passions until they're older. It's a sport and it's supposed to be fun until it's a career. I think the education from the athletes and from the professional leagues is what's key. And you really don't see that much. And I think that would go a long way.
Yeah, absolutely. Yeah. Now, kind of shifting gears over to concussions. I think that's something we think I see a lot about in football. That everyone's kind of always looking at. Someone's going in the tent, are they getting called out? And we're seeing a little bit with baseball over here in the Bay Area with the Giants, with a couple of players getting concussions. But we're not as familiar with the concussion protocol in the NBA. And one of the issues that came up was Derek Lively. They thought it was a neck sprain, and it potentially was diagnosed as a concussion. How does the NBA concussion protocol work, Brian, from a general standpoint? I mean, I know it's obviously a little bit different from league to league, but the principles are the same. But what's kind of your take on the concussion protocol, how players can return to play?
Yeah, I think the Derek Lively injury was interesting. It mirrors a lot of what we see with the NFL. You look at the injury, I thought at least, it looked like he had a concussion the way he acted afterwards. He looked a little bit wobbly. It looked like he couldn't necessarily concentrate right afterwards. But you can see the same thing with a neck strain. You're really, if you're injured, you're focusing on what hurts. If your neck is hurting a lot, you're not necessarily going to pay attention how your feet are acting. But the NBA's return to play process is, if you have a suspected concussion, you're obviously going to be evaluated by the athletic training staff and the medical staff. You can't play within 24 hours of the injury. You have to be without any concussion-related symptoms at rest. And then you're going to undergo evaluation by a physician with a training and experience in concussion management. And that's really important. That doesn't mean you're going to go necessarily to the team physician. The team physician has to have a specialized concussion experience. That's very different than the way it used to be, which could be essentially anybody could clear you and say, yes, you're good enough to go back. Now you have to have expertise in concussion management, which is new over the last 5 to 7 years. You have to complete a exertion process, which is very similar to the NFL and Major League Baseball, which means not only do you have to be symptom-free at rest, but you have to be symptom-free after you go through an exertion level training. So you have to basically be okay to practice, be symptom-free, have a simulated game, and be symptom-free. And then the director of the NBA concussion program has to make the decision with the team physician and make sure that everybody is on board that you go back to play. So thorough, safe, a lot better than it used to be. Thankfully, concussions, for the number of times you see athletes hit their head coming down for rebounds or contested plays by the rim, thankfully, they're actually pretty rare in the NBA, and they're not nearly as serious as we see both for baseball and in football. But I think their process is pretty safe and has been actively engaged in the last 5 to 7 years.
Yeah, no, I agree. And kind of one of the things I think is interesting is that more and more fans are seeing it. I think that when they see a player hit their head, I think before was like, whatever, you just hit your head. But I think, you see on social media, you see announcers saying, oh, is that a concussion? He should be evaluated for it. So I think, particularly, I think in basketball, I think people are understanding that, there's more of a sense of this player should be going out for his safety as opposed to, come on, get him back in. Just kind of like, when I played basketball, I've hit my head 25 times and kept playing. So I think that's an important kind of change in how we're perceiving concussions as well, too. Kind of last question as we kind of wrap up here. One of the Mavs players, Olivier Maxence Prosper, hopefully I'm saying that right. My French is not very good. No, Brian,
mine's not better.
Okay.
You're perfect.
I have an ankle injury. Aiming for a return June 6th. These ankle injuries, we see them, we see players kind of twist their ankle, they go to the tunnel. I think the question I always has, when someone goes back to the locker room, what are they doing, Brian? Like, they twist their ankle. What's the training staff? What are the medical staff? What's going on back there when someone has an ankle injury and they're just running back out to the tunnel?
Yeah, usually, I mean, it depends on the stadium at this day and age. I think a lot of them have X-ray facilities, or they'll have ultrasound facilities. They usually will take the shoe off. They'll see where their tender will give you the sense of whether or not it's an ankle sprain or potentially an ankle fracture. If it's an ankle sprain, is it a low ankle sprain or high ankle sprain? Whether or not they'll be able to come back in to play. If there's a chance that they're going to come back into play, can they just be taped or braced and come back in? Do they just need to be iced for a little bit of time? The ability to get an X-ray in most of these new arenas is fantastic because you can have point of care imaging. The X-ray allows us to figure out, okay, if there's a fracture, obviously they're done. If there's not a fracture, it's really symptomatic management. If we can get the swelling and stability under control, and they end up feeling pretty good in the next 5 to 10 minutes, they may be able to come back. For the most part, though, ankle sprains tend to look scary right off the bat, but you really can't tell based on that initial severity of what it looks like, how that player is going to react over the next 10 to 15 minutes. And it really depends on how many ankle sprains they've had before, how much swelling is involved. So you really want to bring them back, get them away from the crowd, get them away from the excitement of the game, allow them to kind of calm down, get ice on it, evaluate them kind of in the comfort of silence and safety, allow them to focus, see how they feel, and then make a decision at that point. And that's kind of the nice thing about the tent now in the NFL and being able to be away from everybody in the locker room.
Exactly. Anything else, Drew, from your standpoint?
No, I think, a lot of it is like with these ankle sprains, because they can come back pretty quickly, or like it can be something that just like lingers for even weeks. But a lot of it's just like let the initial rush from the injury calm down, make sure that there's not a break that you're going to make it worse. And then usually, tape them up and then see what the player is able to do. Like, can they walk without a limp? That's kind of usually what I'll look for first. Like, can they just walk around, or are they like struggling to put any weight on it? And then if they're walking okay, then it's like, okay, let's try some running, try some jumping. And then, it's all based on like how painful it is and how stable that ankle feels to them. Like, if they feel like they can't push off, then, it's an easy call to say, like, shouldn't go back in. But if they're able to do all that, then sometimes just the taping is sufficient and able to get right back out.
Yeah, I mean, there's no space either on the sideline. I mean, especially for an NBA championship, any space there was during the regular season is taken up by press. You can't do any of the evaluation, can't take their shoe off. There's no place to sit. You can't do an exam. You can't test them for running and jumping. You can't even do it in the runway leading in and out, because that's going to be filmed. So the only place for any privacy is going to be all the way back in the locker room anyway. So I think out of necessity, that's where they have to go at this point, especially in the playoffs and the finals.
Well, obviously, hopefully not many more injuries in the NBA Finals. It'll be a nice, clean series, and no one's saying that they won the championship because of injuries, but obviously injuries play a role in the outcome of all the games that we can see and analyze. So once again, everyone, thank you for listening to our podcast today, 6 to 8 weeks perspectives on sports medicine. You can check us out on the web, wherever you get your podcasts, Apple Podcasts, Spotify, Amazon, and looking forward to having you listen to our next episode. Thank you.
Thanks for listening to the UCSF Sports Medicine Podcast, 6 to 8 weeks, Perspectives in Medicine. What do you think of this topic? Connect with us now. In addition to finding our contact form, you'll also find our social media links in our entire 6 to 8 weeks episode archive. Help us grow our listenership by liking, subscribing, and sharing everywhere. We're eager to hear from you, and we'll be sending you more great thought-provoking content in less than 6 to 8 weeks.